I'm Jan Janssen, Chief Technology Officer at Cochlear. I often get asked the question, what is Cochlear doing in terms of future sound coding strategies? But the underlying question is really, how can we improve outcomes for people with a cochlear implant? The first part to answering that question is that we are continuing to develop new sound coding strategies, in particular using the better modular proximity of the electrical stimulation with the CI532 electrode. Having the electrode closer to the hearing nerve allows us to exploit that proximity in future sound coding strategies. But the second part to answer that question is much simpler, is to make sure that people get implanted earlier, because we know that early implantation provides significantly better hearing outcomes for people with a cochlear implant. And that's something that we can do today. At Cochlear, we're trying to achieve this, on one hand by changing clinical practice, by making sure people get implanted earlier, and on the other hand by continuing to invest heavily in research and development for future algorithms. What I mean with earlier implantation is different for different age groups. For children, for young children born with a hearing deficit, it means implantation as soon as allowed by the FDA guidelines, which is around 12 months. For school-age children, it means implanting or progressing to a cochlear implant as soon as the child meets cochlear implant indication criteria. And for adults and seniors with hearing loss, it's important to progress to a cochlear implant as soon as they don't get benefit from the hearing aid anymore. Today, however, we know that many adults and seniors wait for more than 10 years after they really have met CI criteria before they're getting treated with a cochlear implant, which means that they lost 10 years where their hearing could have improved rather than have deteriorated, and it will also provide them better outcomes over the longer term. And all of this is one of the biggest opportunities in how we can improve outcomes for cochlear implant users.